Now let's start virology part 1. In this we can see we have envelope, nucleocapsid. In this there are two things, viral genome, okay, and DNA, RNA or capsid, right? Then we have to see the envelope. Envelope we have two things, either it will be enveloped or it will be non-enveloped, right? In this we have to see in enveloped part which is sensitive and which one is labile. In sensitive we have three things: ether, alcohol, bile salt, right? In labile we have only heat. In non-envelope we have two things: DNA and RNA, right? In DNA we have PEP, parvovirus, adenovirus, pepovirus. And in RNA we have PARCH, PARCH. P is picorna. Remember that was PAP, that was parvovirus, pepovirus, but here it will be picorna virus, right? Then astrovirus, reovirus, calcivirus, hepatitis A, hepatitis E. These are all the RNA viruses, right? In genome symmetry we have helical, icosahedral. Okay, this is the symmetry. So in DNA viruses we have all icosahedral symmetry, right, except the pox virus, right? So let's come to RNA virus. In RNA virus it has the helical shape. This question has come. So in RNA virus the symmetry is what? That is helical shaped, right? So that is coronavirus, like in 2019, right? This question has also come. So pox virus, so the one which is except pox virus, which was of DNA, except DNA. So in this it will have a complex symmetry, right? Complex pox, right? That will look like same, right? Then we have DNA viruses, DNA and RNA. So usually all are RNA viruses, but we have to remember the DNA viruses, right? So we will remember it by the mnemonic called Heppinomic, HEPPY, right? H means there will be two H, means Hepatodaviridae and herpes viridae, right? So Hepatodaviridae, in this we will have HPV, okay, and then we will have herpes viridae. In herpes we will have, in hepatna we have HBV. In herpes we will have five things, right? HSV, HZV, EBV, CEMV, HHV. Then we have adenoviridae. In adenoviridae we have adenovirus. Then we have poxviridae. In poxviridae we have smallpox, cowpox. Cowpox will be variola, then vaccinia, molluscum, okay. But in poxviridae it does not include chicken pox, okay. It has a pox, but it does not include chicken pox, right? Then we have in Hep P, we have H is done, A is done. In P we will have three P's. Pox viridae is done. Now we have Pepova viridae. In Pepova viridae we will have HPV, BL, JC, polyoma, SV40. Okay, this is the Pepova viridae. Now we have Parvoviridae. In Parvoviridae we will have just parvovirus, right? Then we have bacteriophage, that will be of the tadpole. And also we have already known this bacteriophage will play a role in transduction, right? Rest will be RNA viruses, okay. And in pox virus is the one which is the largest virus, 300 nanometer, and parvovirus is the one which is the smallest one, 20 nanometer. So it ranges from 20 to 300, right? Now it was the viruses, size of virus. Now let's see the genome size, right? In genome size, if they ask you what's the largest genome, that will be retrovirus, okay. And if they ask you what's the smallest genome, this question has come. Smallest genome will be hepatitis D, followed by hepatitis B, right? Now they can ask you about the shapes, right? So in rabies we can have bullet shape. In coronavirus we can have crown shape, right? And also it can be like, they can ask you segmented genomes in orthomyxovirus, okay. So that's ARBO, okay. Adenovirus, rotavirus, bunya virus, orthovirus, right? And also about influenza virus, the main thing is they can ask you what is elentoc cavity. In this the main thing is growth and replication of influenza virus will be there, right? So in and then another we can see another shape and structures. For example, in rabies I told bullet shape, coronavirus crown petal shape, okay. They can ask you the pox virus, okay. Pox means box means dumbbell. It will be dumbbell shape, right? They can ask you Ebola virus. So Ebola means what? It will be bowl of spaghetti, right? And then they can ask you rotavirus, which is caused diarrhea in children, okay. That will be rotating wheel type, okay. Then they can ask you astrovirus. It will be like star shape, right? And they can ask you adenovirus. That was astro, but it is adeno. Adeno means alien, okay. So alien means where alien go in a spaceship. So that will be space viral, right? Then we have tobacco mosaic virus, that will be rod shape. For example, tobacco is like we can say cigarette shape, right? TMV, tobacco mosaic virus. T means in this there will be cigarette shape, and that will be rod shape, right? Now let's see about DNA RNA. So all DNA viruses are double stranded except what? Except parvovirus, right? So in this, it will be single stranded DNA. Smallest size will be 12 nanometer, and this will show slab cheek appearance, right? So for example, we can say like there's Aishwarya Rai, right? So we used to call her Paro. Okay, so Paro means parvovirus, right? So she is the one who remains single, right? So this is how it is. So you all are double stranded, but parvovirus single stranded, smallest size, slab cheeked, right? Then comes RNA virus. RNA is the one which has one copy of unsegmented single stranded RNA, right? So RNA has single stranded RNA unsegmented, right? Except was what? Except retro rota. Retro means two copies, rota means only double stranded RNA, right? Now we can have mnemonic, or it could be like Bora. Okay, it's like BIRA. Then we can see like then another we can see like we have virus cultivation also, animal, embryo related. Okay, in animal we can see Coxsackie virus A, B, suckling mice, right? And then we can see in A it will have flaccid and B will be spastic, right? In embryo related we can see chorioallantoic, yolk sac, all these things we can see. Okay. Now we can see like lines also. We have primary cell lines, secondary lines, and continuous. In primary we can see amniotic and embryo. In secondary we can see CMV, fibroblast. This question has come. In secondary we have human fibroblast cell line, that is PYQ. And in this we can see CMV. Okay. And in primary we have 5 to 10 divisions. In secondary we have 10 to 50 divisions. Then comes inclusion bodies, intracytoplasmic and intranuclear. So in intracytoplasmic we can see Negri bodies in the rabies. Okay, site will be hippocampus and cerebellum of brain. Okay, and then what we can see here is intranuclear. This question has come. So okay, so it is like we can remember it by HAYBAP, HAYBAP. Okay, HAY means A means Cowdery type A. Okay, Cowdery type A. And then what we have is in this we will have a yellow fever. Okay, so where it will be seen, yellow fever will be seen in two race bodies. So 2L and 2R, yellow toe race body. Okay, then we have herpes. Herpes is lips, so it will be like herpes lips shirt. Okay, and B will be BAP, so BAP, adeno and polio. Okay, so this we have done. And also now let's see the one which is both intracytoplasmic and internuclear. So that will be cytomegalovirus, which will be seen in owl eye appearance, right? And also measles, M, just make opposite of M, you will see W. So Warthin Finkelide giant cell, which will be both, right? Now we have a mnemonic called happy mnemonic. Okay, so that will be DNA virus. So we will classify it. Hepataviridae, HBV. Okay, and then we have, so I will tell you like herpes viridae. Okay, I told about 5, HSV, ZV, EBV, CMV, HHV. Then we have Paro. We have Pepova. Okay, polyoma, JC, BK, HPV. Then we have adeno, that will be adenovirus. Now come to herpes viridae family. Okay, in herpes viridae family we have HHV1, simplex 1, 2, 3. In 3 we will have, this 3 is also called as varicose zoster virus. In this, which will be chickenpox or zoster or shingles. Chickenpox will be C, that will be in child. Zoster will be in adult. Then 4 we have Epstein-Barr virus. Okay, 5 will be cytomegalovirus, that is the largest one. Then 6, 7 and 8. So let's talk about 1 and 2, right? 1 is the one which is above the waist, 2 is the one which is below the waist. The one which is above the waist will be in this lesions will be orofacial lesions, right? Lesion above waist, encephalitis and meningitis, all these things will be there. HSV2 means it is the one which will be below the waist. For example, mom to child. Okay, it will be in the adult. HSV was in the children, it will be in the adult too. Okay, and also because it is below the waist, so it will be genital lesions, right? Below the waist. And okay, so these things we have done. Now let's see the most common site, right? So in the most common site, HSV1 is more. So most common site will be buccal mucosa. Okay, if they ask 1 degree lesion, that will be gingivostomatitis. Most common recurrent lesion, recurrent will be herpes, right? So buccal is the common, gingivo is the 1 degree, recurrent is the herpes. Okay, then we have sinus infection. HSV1 is more than 2. Okay, in that it will be encephalitis, most common cause of acute sporadic viral encephalitis. This is the most common one. Okay, then where it will be in the temporal lobe. So now we will have meningitis, this we know. Okay, but where? Okay, so it will be meningitis with molar rate meningitis. This question has already come. Okay, so molar rate, MOLLARET. Double L means lymphocytic, RET means recurrent, okay, and then HSV2, right? So this is the one most commonly seen in HSV2 meningitis, right? So now we have another also. Like we have gladiatorum, that will be wrestlers. Then we have herpes whitlow. Whitlow means W. W will come in another W, that will be worker. So healthcare worker. Herpetic whitlow, healthcare worker, right? Now we have two things. Genital ulcer, either it will be painful or painless. Whenever we have painful, that means Ducreed, right? Ducreed means crash. When someone cries, that will be painful, right? And when it will be painless, in painless it will be in three things: syphilis, okay, lymphogranuloma venereum, and Klebsiella, right? So in syphilis it will be painless, okay. In lymphogranuloma it will be painless, but lymph node will be painful, right? And Klebsiella, that will be donovanosis, right? So herpes we have done. So now comes the lab diagnosis. How do we see the lab diagnosis? That will be zinc smear. Okay, whenever they say STD with painful lesion, this question has come. STD with painful lesion, that will be zinc smear. Okay, lips, should, bodies, right? In this it will be 3M, multinucleated molding and margination, right? So drug of choice obviously acyclovir. Okay. Now comes what is herpes zoster or varicella zoster virus. That will be HSV3. Okay, when we talk about HSV3, varicella zoster, in this there will be two things: child and adult, right? So in children it will be chickenpox, in adult it will be shingles, right? And also smallpox is the one which is opposite to chickenpox, right? So now let's see what is this chickenpox. Okay, so in chickenpox it is the one incubation period will be 14 to 21 days. It will be centripetal. Rash will be there, but it will be centripetal distribution, right? It starts on the trunk and then spreads centrifugally. From trunk it will start, right? And in smallpox it will be opposite. It will be from centrifugal to centripetal. It is going from but chickenpox is going from from trunk to centrifugally, right? And also it will be there in the flexor surface. The classical is dew drop on a rose petal. Classical description of chickenpox: dew drops will be there, rose petal will be there. In this, the most common complication will be skin bacteria infection. Okay, CNS will be there, and most serious will be varicella pneumonia, right? So in this we can also see like we have varicella syndrome. Okay, very means very, syndrome means SYN means small. Okay, it will be from mother to child. Okay, varicella pneumonia, it will be especially in the pregnancy. Now we can see the fetal congenital varicella syndrome. Okay, this is the one which is within 20 weeks of intrauterine life. In this there will be microcephaly, cortical atrophy, limb hypoplasia, and cicatricial lesion, right? So this all will be varicella syndrome, fetal one, right? So we studied the chickenpox, right? Now let's see which is herpes zoster, shingles, right? Shingles is the one, chickenpox has already appeared. Okay, virus is latent, but it is now again reactivating. That will be shingles, right? So this is the one which is latent, reactivated. Usually it will be there in the adult people. Sorry, not adult, it will be elderly people, right? And it is the one when immunity goes down, right? So in this, the classical will be like we can see unilateral rash, right? And in this we can see dermatomal distribution. Okay, in this it will go from D3 to L2. Okay, and also it will be painful rash, shingles, right? So it will be painful rash. Okay, and then what we can see is shingles also called as varicella. So what we can see is shingles also called as zoster, right? So in this it will be varicella zoster virus, right? So all, and we can see the post complications. In the complication, what we can see is post herpetic neuralgia. It will be there, which will be nerve pain. Its drug will be gabapentin, and this is the most common complication. Then we can see ophthalmicus and Ramsay-Hunt syndrome. This is also very common. In Ramsay-Hunt, we can see geniculate ganglion of the seventh nerve, facial palsy, okay, pain in the external and meatus, okay, and loss of the taste sensation of anterior two-thirds of the tongue. This is what Ramsay-Hunt syndrome is there, which is a part of shingles, right? Then we can go. We have seen the three. Now we have to go HSV4, which is the Epstein-Barr virus, right? So in Epstein-Barr virus, we need to know the pathogenesis. Pathogenesis will be first of all Epstein-Barr virus. B is there, take out B cell. Through what? CD21 to CR2. Okay, this will activate what? SRC proto-oncogene, right? And also in this there will be like first it will EBV will be there, then CD21 CR2 will be there. Then what come? B cell will come. Then after that, LMP1, EBNA2, and VIL10. So we can remember it where 1, 2, and 10. These three will be there. So if they can ask EBA2, if they ask 2, so what is this SRC proton gene? If they ask 10, 10 means A10. Okay, that will be anti-inflammation, right? So this is what we have to remember it. Okay, and then comes clinical features. So what are the features? Very important question has already come. Infectious mononucleosis, Epstein-Barr virus. Okay, this is also called as Cushing's disease. Okay, also it can be due to close contact. In this there will be glandular fever. Okay, that will increase salivary gland, increase lymph node, increase tonsil, increase HSM. All these things will be there. Then we can have a malignancy. In malignancy, most important is the carcinoma, which is gastric carcinoma, right? So gastric carcinoma followed by nasopharyngeal carcinoma. All these two things will be there. Then we have lymphoma, two types, Hodgkin, non-Hodgkin. Hodgkin is the one which is mixed, nothing. But non-Hodgkin is the one which is not mixed, so it will have again something. In non-Hodgkin, it will be Burkitt, DLBLC, post-transplantation, right? Third, you can have a sarcoma. Okay, other condition, it could be Duncan syndrome, right? And also in this, there could be hairy cell leukopelakia, right? Which is also in condition in Epstein-Barr virus, right? So this was all the clinical features which I have told. Okay, so usually it's gastric, then nasopharynx, then Hodgkin, non-Hodgkin's, then Duncan, and hairy cell leukemia. Okay, then leukopelakia. Then lab diagnosis. In the lab diagnosis, what do we have is we have Downey cells. Remember the keywords: Downey cells, CD8. Okay, ballerina skirt appearance, Downey cells, ballerina skirt appearance, CD8 cells. Okay, this will be there. Then a question has come in the AIMS that which test do we use in Epstein-Barr virus? Paul Bunel test, which is the old one. This question has already come. But Paul Bunel was the Paul which was before. Now it's a spot which is monospot test. This is new, right? And also IgM heterophile, they can ask you, right? Now antibody can be viral capsid antigen, early antigen, EBNA, right? These three things can be there. So now most specific and most sensitive test will be what? Nucleic acid hybridization test. Most sensitive and most specific nucleic acid hybridization test. This is there. Now comes cytomegalovirus 5. In 5, what we have is this is the one which is the largest. Its reservoir is main. Largest was. And when you ask, see, this is the when you ask in herpes viridae, then it will be the largest cytomegalovirus, which is 5. But if they ask you overall, then it will be pox, right? That will be 300 nanometer. Its reservoir is main. Okay, most common oral, respiratory, and body secretions. Okay, like we have TORCH, right? TORCH. So C will be there here, right? Cytomegalovirus. Less complications can be, then it's multiply in what? SRK in Mannat, right? So just remember SRK, salivary, respiratory, kidney. This will be transmission. So question can come, has already come, that renal transplantation recipient period around 1 to 4 months will be what? So we have to tell it will be CMV, cytomegalovirus, right? And also in CMV we can have there is a bacha, okay, congenital. So and also in congenital there will be defects. Okay, it will be eye defect. So you can visualize a picture. In eye you can see chorioretinitis. Then see the ears. In ears it will be SNHL. Okay, then see the head. It will be MRO microcephaly. Then put one V at the down, that will be periventricular, right? So these all things can be there in CMV. Okay, then in lab what you see, owl appearance, this is the one which I already told, which is both intracytoplasmic and internuclear. Okay, in this it will be 2-line cell. Okay, ELISA and PP65 antigen is detected, PCR, Dugov choices, GAN C Clovir, right? And so this was the thing. So now I will be telling you something about radio plus pedia things. Okay, whenever they say cerebral calcification, that will be toxoplasma. Whenever they say paraventricular, V is there, right? V means cytomegalovirus, V virus, right? Cytomegalovirus. When they say gray matter or white matter, that will be of Zika virus, right? Now herpes, human herpes 6 it will be what? All 6 will become, right? Like CD46. Okay, variant will be 6A, 6B. Infection will be secretions. Oral secretion means 6 accretions. In child, it will be 6th disease. 6th, okay. And then roseola infantosum. exanthem subitum. Okay, Nagayama spots, rash after fever. After fever, rash will come. Okay, so do not confuse with Nagayama strain, because in Nagayama strain it will be JE vaccine, but here it's Nagayama spot, right? So this is the thing. Now rash on soft palate or uvula. Then we have rose pink, non-probiotic papules. Okay, rash after fever, right? All these things will be herpes virus 6. Now whenever it comes to 8, okay, in 8 it will what? Kaposi sarcoma. Okay, Kaposi means vascular tumor. That this is what in this there will be 3 things. First will be Kaposi sarcoma. Second is PEL, primary effusion lymphoma. Third will be Castleman, right? In Kaposi vascular tumor, it will be associated with HIV, lower limb, lymph node, second most common. Okay, PEL will be what? Pleural effusion. It will be CD13, CD48. This question is coming INSAT 13, 38. Then comes Castleman's disease. So Kaposi and PEL was the cancer one, but there is non-cancerous is Castleman disease, right? Okay, I will in Castleman, what is there? This is the one which is it shows B cell symptoms, fever, okay, night sweat, weight loss, and in this there will be onion skinning of lymphocytes. This will be there, right? And just little I will tell you, steeple sign is the parainfluenza virus, and adult T leukemia, that will be STLB1 virus due to TAX gene. T cell is there, na, to TAX gene. This question, adult T cell leukemia means TAX gene. Okay, so now comes the paro. Our paro has come, which is parvoviridae. Okay, I think 8 of them are done. Now let's come to parvoviridae. This is the smallest one, only single stranded virus. Okay, in this spread will be paro is there. So PAR, P is what? Placental. A is what? P means placental and blood transfusion. And A, leave the A, then comes to R. R is respiration. Attack will be what? Attack will also be PAR. P means P attaches to what? P is the antigen which attaches to what? PAR. R means RBC precursor. So that's how paro is there, right? PAR. Then comes condition which associated with parvo B19. That will be what? Erythema infectiosum. So subitum was 6. This will be 5. Infectium. Erythema infectium is 5th disease. This is slap cheek appearance, which is parvoviridae. Okay. Now, what is slap cheek appearance? In this, it will be like gloves and socks will be there. Arthritis, arthralgia. Okay. Then you have aplastic crisis in hemolytic anemia, which will be parvovirus B19. Okay. And there will be pure red cell aplasia, which will be thymoma. And then it will be hydrophytalis, right? So now, what do we have is, whenever they can ask you aplastic crisis, right? This will be parvovirus B19, okay, and which will be associated with hydrophytalis. Okay, in this the bone marrow is shut down. Okay, 5th is infectiosum, right? Then we have PEPOA. PEPOA means HPV. HPV means what? In this there will be 4 or 5 things. PEPOA means polyoma. That will be Merkel cell virus, Merkel cell carcinoma, net skin. That okay. So Merkel cells, net skin. Then we have SV40, which is mesothelioma. JC virus, which means PMLE, progressive multifocal leukoencephalopathy. Okay, brain problem. PMLE, JC virus. Then we have BK virus. BK means DK. Okay. DK means decoy cells, धोखा देने वाला cells, बड़ा nucleus. Okay, that is decoy cells. But this is this mimic cancer cell, but this is not a cancer cell, right? It will be post kidney transplantation patient. BK virus, right? Now we have HPV. HPV is what? This is a very important one. In this 1 to 3 is low risk, only show skin warts. 5 to 8 is high risk. It will be Treeman syndrome, epidermoplasia, all these things will be there. It's 1 to 3, 5, 8. Then we have mucosal. In mucosal, what we will see? Low risk. Okay? Low risk means what? Genital warts, condyloma accumulata, right? Lata means 2. Then it will be secondary syphilis. The rest, after 11, like 6, 11 is done. Now 16, 18, 31, 33, 35, high risk. Squamous cell carcinoma. It will be all other regions. Cervical, penile, anal, oral, esophagus, all. Structure will be what? L1, E2, E4, E5. L1 is what? Vaccine. Okay, E2 is the controller, which is supervisor. E4 and E5 are coelocytes, right? Then we have coelocytes. So what was coelocyte? Which was E4, E5. What is coelocyte? Resin or nucleus. Perihalonucleus. E4, E5, right? Then we have E6 and E7. E6 is P53 policeman, E7 is RB, which is governor. Okay, E6 P53 policeman, E7 RB governor. Now vaccine. One question comes from vaccine. But before this, let me just summarize you. L1 was what? L1 was L1 capsid vaccine. Then comes E2. E2 was controller. E4, E5 coilocytes. Then come E6, E7, E6 policeman P53, E7 RB governor, right? Then come HPV vaccine. So all in all the questions this has come. So bivalent, quadrivalent, non-valent, right? Bivalent was 2, 16 and 18. Quadri means 4. So in this what will happen? 6, 11, 16 and 18, which will guard us, which guard both of them, high risk and low risk, right? In bivalent it was 16 and 18, right? High risk. Now we are non-valent is 9, guard us 9, right? Then we have adenovirus. So adeno is the one in which is spaceship, right? Spaceship virus will be there, alien will be there, PAP, which I told. Okay, so it will be non-enveloped. This will cause what? This will cause diarrhea. Okay, it will be there in infant. So 40. Okay, 40, 41. So 40, 40. So that's why 40, 41, 40, 40 means adenovirus. So that will be space vehicle shaped, right? Then it will be in adenovirus. It will be eye respiratory disease, right? We can see also transplantation, right? So like this we can see in eye, we can see epidemic, swimming pool conjunctivitis, respiratory we can see, transplantation we can see. Okay, so non-valent vaccine, this is usually asked. So it will be 6, 11, 16, 18, okay, 31, 33, 45, 52, 58, right? This was all the thing. Now we have come to hepatitis B. Okay, all hepatitis viruses. Now hepatitis B is DNA and all other are RNA, right? B is the only one which is DNA, right? All are RNA. Now question has come about HAV. So in AV it was RNA virus and Picorna viridae. Okay, so we had also some mnemonic like Picorna, Hippa viridae, Filava viridae, Reli and Calicus. Okay, so now we can see mode of infection only A and E, fecal-oral. Okay, incubation period we can see 15 to 50 day, 15 to 50 day. A and E are same. Okay, rest B and D are same. 50 to 150, 50 to 150, right? It was 15 to 50, A and E, right? And also in envelope also A and E will be not envelope, rest all, right? Cultivar will be only A. Okay, so that's how. Danger one is the fulminant. Okay, so in D it will be the most common cause of pulmonary, but in E it will be pregnancy, right? Then we have some stuffs regarding if just sporadic, that will be E. Fulminant it will be D. If fulminant in pregnancy it will be E. Transfusion will be B. Chronic hepatitis will be B. Okay, maximum risk of potential of chronicity C is there, that will be C. Carrier state will be B. Viral hepatitis causing cancer will be B. Okay, most strong with viral causing cancer will be C. Then we have G, we will have mononuclear cells. So now come laboratory. In laboratory we will have just two things. Jaundice will be there like 2 weeks before or after. Before means HIV shedding in stool 2 weeks prior to 2 weeks after the symptom onset. Okay, 15 to 50 day will be there in HAV. Okay, and first of all in this IgM will appear and then IgG will appear. Okay, so HBV DNA can integrate host and complementary DNA, right? Now we can see SCECES. Okay, then we can see the diagram. Okay, in this we have PCS, surface antigen and liver. So S is the first marker. Okay, and then we can see the infectivity rate and all. So what we can know here is SEMA and SEXI. So in SEMA means SEMA. S means what? HBS will be positive. E means what? HBE will be positive. M means what? M is what? IgM will be there, and A is means acute. Then comes SEG-C. Okay, the same. S will be positive. Okay, E will be positive, G will be positive, and that will be chronic. Okay, then comes recovery. When does recovery happen? Recovery happen only when usually all are positive. Anti-HBV, anti-HBC, IgM plus G, and all positive, right? Then comes immunity. When does immunity? Only one thing will be present, B. If the B is present, anti-HBS is present, then it's immunity, right? When it's window, when only IgM, anti-HBC, when C is present, right? M, IgM, right? This we are done. Then co-infection, superinfection. When B and D are together, co-infection. If B after that D will come, then it will be superinfection. Ground glass appearance of hepatocyte. In this, it will be HBV. Okay, B means due to HBS, then special stain, then porcine, right? Then we have council bodies, council main bodies, HCV, C2C. This will be seen in viral hepatitis, hepatotic bodies. Then we have fatty liver, HC. Okay, then we can see in fatty liver, and then we can see that will also be in the hepatitis C. So council main and fatty liver all will be in the C. Okay, then we can have chronic hepatitis. If it is staging, then fibrosis. If grading, then inflammation and necrosis. So thank you. Virology part 1 is done.